Each 5 weeks we'll see your child for an adjustment, approximately each 5 weeks. And then the first half of that treatment, about 10 months of these adjustments, will be concerned with our first objective of treatment, which is getting the teeth straight, making your child's mouth cosmetically pleasing and having a nice smile. Each of those visits will be concerned with getting crowding taken care of, with closing spaces that need to be closed, and improving the appearance of the child's teeth. At the end of that first 10 months of adjustments, we will have an upper arch, upper teeth that are nice and straight, a lower arch that's nice and straight, but many times the upper and lower teeth are not fitting together as well as we'd like to see. So the second half of the treatment, the second 10 months of adjustment or thereabouts, is concerned with the second objective, which is getting the child's bite corrected. That means we want this straight upper arch and straight lower arch to fit together as well as possible so that your child will have a comfortable and efficient bite. So we spend the second half of the treatment concerned with getting the bite corrected. Each of these adjustment visits will change a wire or will add an attachment to the braces to get a various movement that we might need to get accomplished that particular month. At the end of 20 months, and that's a very approximate figure on some children whose teeth just respond a little bit better or who've had some preliminary work done, it may be less than 20 months for a complete case of braces. Other cases, treatment may be slower for one reason or another, and it may be 24 months or more. But however long it takes for us to get the most satisfactory result that we think we can accomplish for that particular case, we will remove the braces in another long appointment. We will take about an hour and a half to take the braces off. The teeth will need to be cleaned up, all the adhesive removed from the teeth. Another set of records made, the molds and x-rays and photographs will be retaken so we have a before and after picture of your child's treatment. And also retainer impressions will be made that day. When we take the braces off, we're concerned that we want to keep the teeth in the position that they're in. And to do that, we need to use retainers after the braces are gone. On the lower arch, we usually use a cemented-in wire behind the lower front teeth that will stay for several years to keep those teeth from moving. The upper arch, we use a clear plastic retainer, removable type, that the child will just sleep in for a couple of years. The retainers will be included in the fee that you've paid for the braces.